We're defining a new normal. And to me, that's the path to recovery. And it has to be attractive. You know, it has to be more than just saying no. If you can't give an addict something that says yes to life, I don't think you're offering much. And I think that's the challenge for the recovery field today.
Something about seeing someone that goes to prison for 20 years, 25 years, and their family dies while they are incarcerated. And they have nothing to come home to. They really don't have the support to do what the system wants them to do.
We put such shame on people that use substances that we drive people into darkness, into isolation. The further into darkness they get, the more dangerous their drug use becomes.
I thought I still had the power of choice. So I thought that I could choose to stop whenever I wanted. The trouble is I couldn't stop. And I couldn't figure out why.
Coming all the way up.
Recovery has been such a gift that I don't think of addiction as a problem or a catastrophe or that stumbling block that I overcame. I think of it as the opportunity to become the most extraordinary version of myself.
According to the CDC, median monthly overdose deaths for 10 to 19-year-old kids and teens increased 109%.
85% of addicts who don't complete sober living or aftercare treatment struggle to achieve long-term sobriety.
The county needs more peer support and education, while it works to expand access to treatment, harm reduction services, and the overdose reversal drug Narcan.
I came from a family in New York City, a long line of alcoholics. Irish Catholic was our background. Drinking was part of the culture. It was expected. First drunk was at age 12. I won a bottle of wine at a church bazaar. They said, "Bring it home to your dad." I said, "Sure." A friend and myself went behind the garage and finished it off. And it took me to a place. It delivered for me. Till it didn't anymore. I volunteered at an alcohol and drug treatment center in downtown Detroit. And they said, before we turn you loose on these patients, we want you to understand what the process is. So they put me through treatment, and I started learning about alcoholism. And, you know, we all have our different misconceptions, really, of what the illness is about. It registered with me at the head level, but not at the heart level. There were two sides to me. I wanted to look good and be good. I mean, I don't think we addicts are bad people, you know. I think we're stuck. I said, well, I'm either going to go to India and get really holy and join an ashram, you know, or I'm going to go to Australia and get drunk and stay drunk for the rest of my life. Those are my choices. And then I heard the voice, and the voice said, "Bill, you're 27. If those are your choices, there's something wrong with you." And that was the key for me. And that's what I think what has to happen to every addict who really finds recovery. When I was back in Detroit, I remember meeting some people from Texas who told us, you know, in Texas, they have a commission on alcoholism. And I was so amazed by that. I mean, it was like somebody actually thought enough about alcoholics to create a special commission for them. Well, when I got to Texas, that commission was by and large the funding element. It morphed to become the Commission on Alcoholism and Drug Abuse, became TCADA. Austin Rehabilitation Center was hanging on by a thread when I got there. I'd never worked in a state-financed facility, and that's where they were primarily drawing their revenues from. It was really minimal. I mean, they were getting like $56 a day, as I recall, for residential treatment. And so the services were less than adequate. And that was my job, was to find a way to turn it around, that the community did not lose this tremendous resource that it had.
You know, it was the largest indigent provider in Central Texas, and you had a sense of community.
You know, it was kind of a grassroots residential. And that's a key piece for addiction treatment. And it's one of the things we've lost in Texas and in many places around the country. I devised a strategy of self-pay. We would draw as much money from the state as we could find to finance people at $56 a day, but our course costs were $80 to $90 or $100 a day. Well, I got to make that up somewhere else. So these other people are going to come in and they're going to maybe pay $150 a day. All right? And the difference is going to subsidize the state people. ARC was always dedicated, committed to helping the poor.
What I saw happen was it became more privatized. It pushed certain people out where they weren't able to afford to be there.
So you have to really keep your eye on helping the guy or the gal who's down and out. And if it's just to make money, or if it's just to meet the bottom line, you're going to lose it.
I am a native of California, Oakland, California. I was raised there. My upbringing was pretty normal. My family worked, working class people, but I started using substances pretty young. My mother was an alcoholic, so I was somewhat groomed to use. I was able to navigate my way through college, but it wasn't the way it should have been because I was using drugs. At that time, I wasn't aware that I was dealing with the disease of addiction. And it finally came to a halt when I almost lost my life. By the time I got to recovery in 1994, I was here to stay. I had no reservations. There wasn't anything that hadn't happened. I lost everything. I lost my children. I lost my self-worth. I lost it all because I chose to use. Something happened for me when I was in treatment. I realized that the thing that had escaped me for such a long time, I walked right into, and that was being a helper. I remember sitting at Austin Recovery, and I knew that I wanted to go into the field of counseling. I never had a passion for anything. But at about 18 months clean, I went back to the treatment facility that I got clean in, and I began to work there. There's something about a person walking in feeling hopeless. There's something about a person walking into my office without any type of knowledge that they can stop using. It's something about seeing a person grow from being an addict on the street to becoming a productive member of society. There's healing in that, even for me. At Clean Investment, I worked with offenders that were transitioning from the prison system back into society. Maybe have spent 30, 40 years, hadn't driven a car in 20, 30 years, to be able to see them overcome those obstacles and to do it and know that you might have been just a light, just that one person that could say, you can do it. There were times when we felt like other folk could get clean, but I can't. But if I'm coming in off the streets, I need to see people that look like me. I need to see people who talk like me. And if you don't know what that struggle is for me, you can't really help me heal from that. There are individuals that have told me that I gave them hope, being an African-American woman who is still in recovery, who's still very active in recovery, that each time they would go out and come back, you're still here. And eventually some of those women got clean. I was offered a position by the Austin Area Urban League. They're an organization that deals with 5 pillars in the community. And one of those pillars is health and wellness. And the one area that was pretty much open was the substance abuse. When we look across the United States with all of the Americans that are unhoused, it's unfathomable. And for those that are drug addicted, my hope is that I can be a part of this great big mosaic that can help an individual see recovery as an option.
If you equate treatment and recovery, then you haven't taken a very deep dive.
People talk about treatment as if I hear politicians say that. Well, we need more treatment. That's a big word, and it needs to be broken down.
You go to treatment, you're fine, you're done. You go to rehab, you're fine, you're done. Go get on with your life. Well, that doesn't work. I think the evidence is in. The only thing that works to do is to generate income from treatment providers. So what happened during the 80s and 90s as addiction treatment gained momentum, a whole bunch of money got spent on treatment. Partly because of the cocaine crisis of the 80s, also partly because the incidence of alcoholism seemed to be climbing. Once it became very, very profitable to start marketing addiction treatment, and once advertising for addiction treatment became real important to the advancement of addiction treatment, you had a snowball effect, almost like an avalanche. Nowadays, here we are in 2023, most large addiction treatment centers are corporate owned. They're Wall Street. People are generating huge sums of money and they're not delivering quality care. And I'm not saying that treatment is bad. I'm saying that treatment is so wholly inadequate that we need to go a lot further.
Treatment is what I need. Recovery is what I want. Once I begin to get some counseling and I'm talking to folk, and then I separate myself from the chemical. And I stay for a little while longer and I separate myself from it. Then comes recovery.
You know, when I first got into recovery, I probably would have said recovery is just stop using drugs. And that's really not recovery at all. Recovery is like not using drugs and then learn a new way to live. This is my youngest son, Brandon. This is when he graduated high school. That's my dad. My nephew, who we lost to addiction last year. I've worked in the field of substance use disorder for over 30 years. And I play music is the fun part of my life. I play Cajun music. I grew up in Beaumont, Texas, right near the Louisiana border. I started using substances at a young age. And I was functioning pretty good for a while. And then as time progressed, my using progressed. Started getting in trouble with the law. So it started affecting me in every area of my life, really, physically, mentally, and definitely spiritually. I went to Austin State Hospital at 88. I got there through court commitment. I stayed there for like 30 days, 35 days. They sent me to a place called Austin Recovery Center. And so I went out there, stayed. It was a 30-day program. And then they sent me to a halfway house. So then I got out. So I decided to start taking some classes at Austin Community College. And I thought maybe I'll go pursue counseling for drug use. I mean, that's the one thing I knew more than anything else. I started off volunteering at Austin Recovery Center. 2004, I went to work for the Texas Department of Health. When I got there, I'd have conference calls with people at different states talking about the opioid problem that we're starting to see and you're starting to hear about throughout the United States. And so I went to my boss one day and said, hey, we're the state authority for substance use, and we have an opioid problem in the state and no one's talking about it, no one's doing anything about it. And he agreed. It was about 2013 that myself and a guy named Mark Kinsley got together with some community folks and started talking about what we could do to get ahead of the epidemic before it hit Texas. In 2014, and that's when Tony was born, Texas Overdose Naloxone Initiative. Mark actually put that together and brought me on, called me one of the co-founders. When we first started Tony and going around the state training, we tried to get into training. It's like, okay, who's dying? Drug users, right? We need to train drug users and really need to train drug users' families and spouses and neighbors and housemates and all, because the medication, naloxone, Narcan, that is used to reverse opioid overdose can't be self-administered. So someone has to rescue the drug user. So we're really trying to train that population of people that was associated with people who use substances or people who use substances. But with the stigma associated with substance use disorder, people hide to use. You know, we put so much shame on substance use that people don't openly use. People hide. And you hide, you use alone, you die.
I am a medical doctor by training, and by the time I had arrived in Austin, I was burned out on medicine. I actually didn't plan on practicing. I did go ahead and get licensed in Texas, and I thought I would do some moonlighting in emergency departments. Unfortunately for me, I had a history of having consumed alcohol without negative consequences. I thought, well, I can manage this. I can handle this. The Texas Medical Board had put me on probation because of an arrest for driving while intoxicated and a conviction. And indeed, I was intoxicated while driving and actually ended up having my medical license revoked. That led me to get care, fortunately. Luckily for me, I sought out a local addictionologist, Dr. William Loving, and he was instrumental in helping me with attain sobriety. As my relationship with Dr. Loving developed, I found out through him about an opportunity to work for the state of Texas. The Texas Recovery Initiative, or TRI, really came about as the accomplishment of a vision that a man named Philander Moore had. He wanted to enhance the ability of people who had been in treatment funded by the state of Texas to go into recovery and stay in recovery and not have to get readmitted over and over and over again to the treatment center. Many systems of care will fire you or discharge you or get rid of you in some way or another if you relapse. Well, that's crazy. That's just crazy, you know? And those systems are oriented around treatment, quote unquote, as if you could take a problem-oriented approach to the disease and eliminate symptoms and fix the disease.
People still think of recovery as going to rehab and then coming out and staying abstinent. And if you resume use, that's a relapse or a failure.
What you can do, however, is promote a change in one's orientation towards life and a change in the way that one lives one's life, and provide for them a community or a tribe, if you will, of supporters that helps them manifest that change in their life.
It really captures the need for all of these aspects of a holistic human being to be addressed.
And that process of change is managed by people who have a stake in that individual's success, called recovery support providers. We call them recovery coaches. We call them recovery navigators. They are people, by and large, that have lived experience of addiction. They know what it's like. So they're not receiving treatment from somebody so much as they are being guided, empowered, and inspired to make the kinds of changes that they need to make in order to live a free and healthy life. In San Antonio, where you have Haven for Hope, provides housing, provides health care, medical care, mental health care, provides addiction care, jobs programs, all on one campus. Once they move from there out into the community, they actually are moving into housing opportunity that is promoted by the larger system of care, the recovery organization. In Austin, there is an organization called Communities for Recovery that's key to training recovery coaches, recovery navigators throughout town, making general services available. I think Recovery in the Park is a great example of how in recovery, community is essential. People who suffer from addiction love other people. The disease process tends to isolate them, however. So when we have a celebratory event, we're basically celebrating the fact of our recovery, and we're sharing the recovery as we celebrate the fact of our recovery. So the Texas Recovery Initiative came about as a result of us wanting to spend our treatment dollars more wisely. So it was born of necessity. And it also turns out to be a great way to promote recovery.
My mother was an addict alcoholic in the 1970s, and she was at first misdiagnosed everywhere we went. I remember the day we were at a psychiatric hospital and a psychiatrist came in and looked at my mother and without hesitating said, "Let's see what this woman looks like if we dry her up." And my mother started her recovery at that point, and I was 10 years old. So I was absolutely determined that that would not happen to me. As it turned out, in my junior year of high school, I was in a rock band, and we were practicing in a cold barn in New Jersey in the winter. And someone handed me, I still remember it was a Moosehead beer. And I thought, well, that looks pretty good. And they said, this will warm you up. That was the start of my genetically predisposed addiction to alcohol and substances, which continued through my senior year into my college years. I started my recovery in Pennsylvania, in Philadelphia, while I was undergoing my master's program. I quickly became aware that part of the healthcare system was this designating, were you on this camp or that camp? Was it mental health or substance use, as opposed to how can we concurrently address all that's going on with you? My then husband and I moved to the Phoenix, Tempe, Scottsdale area. I met a fairly new assistant professor at the time named Flavio Marsilia. He had great interest in interracial relationships, how kids chose peers. I had an opportunity to be an ethnographer on an interdisciplinary project with him. And it also was the foundation and springboard to the creation of the SAMHSA-supported Keeping It Real drug prevention program. That's a culturally grounded drug prevention program for youth. REAL stands for the acronym Refuse, Explain, Avoid, and Leave. In a time where just say no was still an undercurrent. So one of the things that I decided when I brought Keeping It Real with me to Texas as a new professor was that perhaps the best place to be doing prevention is in community agencies and really addressing populations that really needed it the most. I think that kids at this age were not used to being valued for that experience and celebrated for that experience. And that really creates change for young people. I was diagnosed with breast cancer. So I continued my administrative position at UT, but had to take a bit of a hiatus from my research. The suggestion was made by the director of research at the School of Social Work. She said, why don't you call up one or two of the gurus in your field, the folks that you have so much respect for, that if they knew your story, that you would trust them to plug you back in. So the first person to come to mind was Bill White. He definitely is one of the most impactful researchers and disseminators of information about research when it comes to recovery. So I called up Bill White, told him my predicament, and after hearing my story of my work and my desire to sort of embark on something that would really be the most relevant piece in the puzzle, he said, recovery schools. We're talking about a recovery high schools, actual schools where the young people that show up there are kids who have had treatment and now want to embark in a life of recovery, and the whole school centers around recovery support services. He said to me, you're in luck, because I think in about 2 weeks, there's a conference in Houston that's being given around this concept of recovery schools, and you should get there and witness it. Because there is a recovery high school there called Archway Academy that had been around for a little while, and they were hosting this conference. And I was absolutely blown away when I showed up on the doorstep of Archway Academy. And I had never seen young people with as much enthusiasm for their lives, as much poise, commitment, accountability, passion, comfort in their own skin, and a desire to pass on what they had learned about recovery to other kids. And I was absolutely sold from that minute. I just knew that that was what I needed to be doing. And when a community needs one, the resources become available, the people, the passion, the power. And before we knew it, in 2014, we were opening our doors in Austin. We decided on the name University High School. One of the unique characteristics of our version of Recovery High School was that we had a formal relationship with the University of Texas so that we might have mentors at the Center for Students in Recovery, and so that kids could learn how to get comfortable as a sober person on a college campus and feel more comfortable in paving the way for their eventual pursuit of higher education. I've invested a lot of my time and energy trying to create environments that are conducive to recovery for people very early in their lives. But I have been in recovery since August of 1987, and it is the greatest joy of my life. It is the focal point of my work, and it is the stuff that miracles are made of.
Well, when I left Austin Recovery, I kind of resolved that my time with treatment centers was over. I recently celebrated 50 years in recovery. It was kind of a milestone for me. I've come to a much greater appreciation for the people who went before me, who carried the torch, shall we say, of what recovery is really about. And I met a really good number of those men and women along the field who were inspired and challenged and delivered on what recovery can be and how do you bring it about in the conditions you're presented with.
I remember using for the last time, April 23rd, 1994. And it was probably one of the loneliest times of my life. And I remember walking up a street in East Austin, and I was just totally an abandoned person. And I remember just asking God that if you help me stay clean, I will serve your people. Unbeknownst to me, what was gonna come. I got licensed in 2010, and in 2020, I was ordained. I am now lead pastor for a ministry in Austin, which is an expansion ministry for the Greater Calvary Bible Church.
There was a big Cajun belt, too, that kind of came through Beaumont and Port Arthur and Orange. I think they kind of missed the line when they drew Louisiana. I miss my culture, and I'm really, really proud of it. You know, the very thing that I thought I kind of needed to get away from is the one things I really got lonesome for. I've always been a big fan of Cajun music. So I started a band in 2004. It's like taking me to a place I never thought I could go. With joy, the music. It brings me back to my culture.
So it gets better. It absolutely gets better. And you can actually be happy, joyous, and free. That can be your primary experience of everyday life, that you're happy, joyous, and free. And that's worth working for.
I literally don't know anyone with a substance use disorder that didn't experience that pitiful and incomprehensible demoralization. That dark, lonely, isolated, and hopeless space. What I want people to know is that taking the step and doing the next right thing, whether or not you believe it can happen for you, is that step into the possibility. And you wake up one morning and you look back and you think, I'm a different person and I have hope.